we'll go ahead and get started. Again, my name is Leanne Foster, and I am a provider outreach and education specialist here at WPS Government Health Administrators. I again want to welcome you all to our webinar on chiropractic provider enrollment and coverage basics. I'll start with our disclaimer. So the material presented today is accurate as of today. As you all know, Medicare changes often. So I'm encouraging you to please make sure that you are reviewing official CMS communications, which does include not only the CMS website, but also the WPS GHA website to make sure that you're always using the most up-to-date and current CMS rules and regulations. The material I'm presenting today was created using these regulations along with pre-submitted questions that you sent in during your registration process. And I'll also be answering questions today based off of those current regulations. I also want to make you aware that photographing, screenshotting, or recording this education for profit-making purposes is prohibited by CMS. As I mentioned moments ago, we are recording this session, and we will be posting this to our YouTube channel as an encore as soon as possible after this session. Now, we will post that barring any technical issues that we may have with the recording. It will be available in the next week or so. This is going to allow you to view it again if there's something you want to see again, something you want to refresh your memory on, but it's also going to allow you to share it with anyone you know that maybe was not able to attend, but they would find this information helpful. So that brings me to our agenda today. The focus today is going to be on the basics of enrolling chiropractors and an overview of chiropractic claims submission. And the things that we'll cover today, we're going to help you gain a better understanding of what the enrollment process looks like for chiropractors. And then we're also going to talk about some basic coverage rules and documentation rules for chiropractic care. There are also going to be in your presentation today, and I'll mention those throughout the session, resources that are available to help you make navigating the Medicare program a lot simpler. So I'm going to start with some acronyms. As you know, Medicare uses a lot of acronyms, so to make things a little bit easier, I have included a list of acronyms that I'll be going through in the presentation today that I'll be using. So I will be starting with the CFR, which is the Code of Federal Regulations. That is essentially the law that governs the Medicare program. I will talk about the identity and access system just a little bit. We'll touch on that. That is related to our provider enrollment chain and ownership system, or PACOS. I'll also talk about the National Provider Identifier, or NPI, and the system that regulates that, which is the National Plan and Provider Enumeration System. I'll also refer to that as NPES. The Provider Transaction Access Number, that's the PTAN. That's the number that MACs will assign to providers during the enrollment process. Then I'll also reference the Program Integrity Manual a little bit that we also call the PIM, and that has all the guidelines for provider enrollment. I want to start out by just talking a little bit about chiropractic coverage. So Medicare does provide coverage for chiropractic services for therapeutic treatment for subluxation of the spine. The coverage is provided for manual manipulation of the spine, and it's on a little bit of a limited basis, and we'll talk about that as we go through this, but it is limited to that manual manipulation. Now, sometimes the providers will just use their hands, or they'll use a handheld device to assist with those manipulations. When that handheld device is used, the services are covered as a manual manipulation. However, Medicare will not provide additional payment when that device is used, and Medicare is also not going to cover or pay separately for the use of that device. And it's something to keep in mind. Chiropractic services also must be medically necessary, and we'll talk about the documentation for that to support that medical necessity, but they do need to be medically necessary to correct that subluxation. Medicare doesn't consider maintenance therapy to be medically necessary. So typically with medical necessity, we're looking for something that is actually going to improve the patient's condition or correct that misalignment. Medicare also, like I said, excludes maintenance. So maintenance usually falls into the categories of its treatment to prevent that subluxation or treatment to maintain or prevent deterioration. So the documentation as we get into this is going to be key to proving that medical necessity. And at the point that further improvement cannot be expected, that's typically where it's considered supportive care and not payable by Medicare. But first, to bill for these services, a provider does need to be enrolled in the Medicare program. So here I'm going to switch back over to provider enrollment. We'll come back into claims in a few minutes later on in the presentation. But first and foremost, provider enrollment. So chiropractors are enrolled as a physician specialty. They're considered in the same category as MDs and DOs. Obviously, they're not going to be billing for those same codes, but their requirements are outlined in the Medicare Benefit Policy Manual, Chapter 15, and the CFR 42, Section 410.21. And I'm going to pull those up. So I'll start with the Benefit Policy Manual. And to get to that, I'm simply going to the CMS website. I'm also including a link to this benefit manual in your presentation today so that you have that, but I want to show you how to locate that otherwise. So you'll go to the cms.gov website. Now the quickest way to get to a manual is going to be using those top resource links. The manuals are consistently here and fewer clicks gets you to your information more quickly. Underneath the manuals and forms segment, you will see internet-only manuals. And from here, you will see the publications. And we're going into 100-2, which is the Medicare Benefit Policy Manual. And once we're into the manual, the section that will include information regarding chiropractic care is going to be Chapter 15 for covered medical and other health services. And it'll bring you to that table of contents. These are links. So section 30.5 covers chiropractic services. And you will find a lot of information in here from a provider enrollment perspective. Typically, we're leveraging the PIM, or that Program Integrity Manual. However, because chiropractors are considered a physician specialty, their requirements are very similar to a physician that's enrolling. So if you're looking for educational requirements, those are really going to be housed out in the benefit manual. And that is, again, that section 30.5. And we'll talk about this a little bit more, but it does provide that additional information. The CFR 410.21 also includes information regarding that. Again, a link is provided for you in your materials today, but this also includes the qualifications that provider enrollment would be looking for when they're enrolling a chiropractor into the Medicare program. So like I said, they are considered a physician specialty. So that also means they must be licensed by the state in which they are practicing. If you have a provider who's enrolling in, maybe going to provide services in multiple states, I oftentimes will use Michigan and Indiana as an example. They share borders. If they're providing services in both states, the provider is going to need to be licensed in both of those states. Now, the benefit of that license, though, comes back to educational requirements for chiropractors. MACs work with their state licensure agencies to confirm the information that state licensure boards require for licensing various providers. And that includes educational requirements to reduce provider burden wherever the state is following the same requirements for education that Medicare does, where those align. We can leverage that state license as the only piece of documentation that we may need, because in order to get that, they had to have the same educational level that CMS is requiring. So what that also means is we're not looking for a diploma for chiropractors. School does need to be reported on the applications. However, we're just looking to make sure that they're licensed, they're going to meet CMS requirements. As I stated, they do have to enroll to bill, and to do that, we're going to talk about how you get this, but they are going to need to be assigned a PTAN, or that Provider Transaction Access Number, in order to bill Medicare for services that are covered by Medicare. So here I'm just going to give you a high-level view of what that enrollment process looks like, the steps that need to be taken. So if a chiropractor is new to Medicare, they are going to need to obtain a 10-digit MPI number. Now this 10-digit MPI number is the number you are going to use to bill Medicare. The PTAN is a little bit more on the back end. It is a number that's leveraged by the MACs that contains a bunch of metadata that helps us adjudicate the claim. And the things I mean by the metadata, it's going to include practice location information, obviously your specialty information, where should the payments go, and providers may have multiple PTANs, especially if they're working for multiple clinics. They'll get a PTAN for each clinic that they're working for. However, they'll still be able to bill under that one NPI, and the system will know how to connect those with the PTANs that they have. Now that 10-digit identifier, that NPI, that is not assigned by the MAC. The PTAN is. That NPI is assigned through an enumeration system, which is the MPES system that I referred to just moments ago. That is something that all providers that provide healthcare are able to obtain. Getting an MPI does not guarantee Medicare coverage or that you can bill Medicare. MPES provides enumeration of that MPI for all benefit and insurance companies. So that's something to keep in mind. Just because a provider has an MPI does not necessarily mean they're eligible for Medicare. They still have to separately enroll. That system is just going to ask for a lot of basic information, mostly contact information. It will ask a little bit about licensure information, and it's pretty quick and painless. To get one, it honestly can take less than an hour from the time of starting that enrollment to the time of actually getting that MPI. Once you have that, then the provider needs to submit a CMS 855. The CMS 855 is the enrollment application form that providers use to obtain that PTAN. We'll talk about this more, but it can be submitted a couple of ways. It can either be submitted electronically through our PACOS system, or it can be submitted through a paper application. Once that is reviewed and in that process, a couple of things will happen. If everything is there and we're able to vet everything on that first submission, we'll go ahead and continue processing that up into assigning that PTAN. You could also end up in development if we're missing any information, if something is unclear, if something needs to be substantiated. So that is the purpose of that enrollment system, just making sure that we're vetting the providers and that they don't have any adverse legal actions in their background that might preclude them from enrolling in Medicare. Once you're through that process, like I said, the final step is that PTAN is assigned. Again, all eligibility requirements are met. We've done all of that background check. And once you have notification, which you will receive generally through an email, once you have notification that that PTAN has been assigned, the provider is ready to bill. A chiropractor may submit forms for multiple actions. It's not just about let's get a PTAN and then we're good to go. There's some maintenance in that. But there's a few submittal reasons I want to talk about. So from an initial enrollment perspective, this is a chiropractor who is one of two things. They're either brand new to Medicare and they've never been active in the Medicare program, or they've been deactivated. They don't have any active PTANs anywhere. That is an initial enrollment. It could also be that you have a provider that is new to the jurisdictional state. I mentioned earlier the Michigan, Indiana example. So if you have a provider that is enrolled in Michigan, now they want to enroll in Indiana. When they enroll in Indiana, they will be And what that means is they may be providing information that they've provided in a previous state, but we ask a lot of base information. We ask about the education on the application. We don't necessarily need that diploma, but then we also ask about that licensure information, adverse legal history that the provider might have. When a chiropractor is enrolling, they have a couple of options for enrollment. The first, and probably one of the more common ones, is reassignment. So what a reassignment uh, um, is a scenario where the provider has an employer and they're reassigning their benefits to that employer. The provider would still appear on the claim as the rendering provider. However, in a reassignment scenario, their PTAN is connected to the group, which is their employer. So it's connected to their group's PTAN. All of the payment information is going to be leveraged from that group, and that group will receive payment. The individual chiropractor will receive payment from their employer based on their employment arrangement. That happens quite often. The other thing that we see is private practice. So this could be a chiropractor who is establishing their own business, their own practice. They can do that either utilizing their social security number only, or they may choose to incorporate and actually get a corporate tax ID, which would establish a group and member scenario where they would reassign to their own group. However, there's a streamlined process for those. They can also set up a group. Oftentimes this happens if you have multiple chiropractors going into partnership. At that point, they're not in a solo private practice. And when we talk private practice, we're usually talking a solo situation. They're in a partnership, or maybe there's a few chiropractors, 3, 4, what have you, multiple owners. Or there are some owners that are not medical practitioners. In that instance, a group would be set up. So the business itself would be structured with a PTAN, because again, that's where payment information is going to come from. And then any chiropractors or other medical providers that are providing services with that group would reassign their benefits to that group. That's the initial setup. Now, it is, as I said before, it's not as simple as you set up once and you're done. It is very important that providers maintain the information on their provider records. This ensures that that information is current, because this information is not only used to adjudicate claims, but it's also used to contact the provider should CMS direct them back to do so, or should we need to reach out for a multitude of reasons. That can be from claims development, it could be even a revalidation, which is something that is specific to provider enrollment. So periodically, providers do have to revalidate all of the information on their file. It's not all that dissimilar to an initial enrollment. We're asking for much of the same information. It's streamlined a little bit, and we're not going to assign a new PTAN unless there are changes that warrant that. So this is something that happens periodically, and it's typically every 5 years. If you're joining us today and you're familiar with revalidation, I do also want to point out that given the COVID-19 public health emergency, we are restarting revalidations. And so that 5-year cycle has been thrown off just a little bit for some of our providers that were due for revalidation during that PHE. Now, as far as revalidation, providers will be notified when it is time for them to do that. So this isn't something that providers will be able to forget. There are databases that will help them monitor that. There's information in PACOS that'll help a provider monitor that. However, MACs do send out notification letters 60 days in advance of that revalidation due date to allow the providers time to get everything together and submit that revalidation timely. I do also need to point out that chiropractors are ineligible to enroll purely for the purpose of ordering and referring services. Chiropractors would need to enroll or opt out of the program. There is an application referred to as a CMS 855-0 where the provider does not actually get a PTAN. We merely get their MPI loaded into PACOS. That is not an option for chiropractors. So once you've identified that the provider does need to enroll and the provider application scenario that needs to be submitted, you do have a couple of ways, as I mentioned before, of submitting that application. So the most efficient way, this is the image you're seeing on the left, is going to be the Provider Enrollment Chain and Ownership System, or PACOS. This is the system of record. MACs use this to establish the enrollment records, but providers are also using that to submit those applications. You would need to gain a user ID and password through that identity and access system that I mentioned earlier, but it's also the same system that issues you a user ID and password for the MPES system to get the MPI. So those sign-ons are interchangeable, which streamlines things for you. But the way PACOS works, it's not all that dissimilar to tax software that you may use on your own. It asks you several questions to establish what your intent is, and then it presents you with the fields that you need to complete to provide the MAC with the information that they need to execute that application scenario. The other option is going to be the paper CMS 855 application. These are available on CMS's website, and they are PDF templates. So you can complete them in the template. However, at that point, you do need to download them or print them, and then they need to be physically mailed into the MAC. The only electronic method of submitting an application is PACOS. MACs cannot accept faxed or emailed applications. If you leverage that paper application, it does need to come in to us through traditional mail. Now, I'm always going to advocate the use of PACOS. It is absolutely by far the most efficient from a submission standpoint, because as soon as that is submitted, within the next 24 hours, the MAC can see that, ingest that into their system, and leverage some automations from that screening process. And you'll also see some real-time status updates. Conversely, a paper application that has to be physically mailed in, so that's a couple 3 to 5 days from the time of completion. Once that comes in, it does need to go through our mailroom process. It's got to be opened, it has to be scanned, they have to ingest that into our workflow system, and we cannot leverage automations for processing that. We do have to manually review that. So in comparison, the processing time for a paper application is up to 30 days, and that is calendar days, not business days. For PACOS, it's 15. So it's just something to consider. I also encourage you to check out our YouTube channel for videos. We recently did a PACOS Basics seminar. So if you're not already a PACOS user, that could be very helpful to you as far as setting that up. So the applications that a chiropractor will use, they'll use two. They'll use the 855I and possibly the 855B. Again, this is going to depend on your enrollment scenario and what you're looking for. So the 855I is used for providers in private practice that I talked about. We mentioned the use of that incorporated tax ID as a sole owner, or that unincorporated tax ID or social security number as a sole proprietor. That would be an 855I. Even in the case of the incorporated tax ID, we'll get their business information on one form, so they'll only need to do one. The 855I is also now being used for reassignment of benefits. Late last summer, CMS consolidated two forms so that reassignment information was no longer reported on a separate form. It was previously referred to as the 855R. That reassignment information is now reported in Section 4F of the 855I. So again, it reduces that provider burden. One form, whether you're established in reassigning benefits or previously you needed two applications if you were new. It's now all on that one form and one-stop shop. The other form is the CMS 855B. Now this is necessary if you have a group with multiple owners. So I mentioned a partnership, or perhaps you have owners that are not also the practicing provider, not also the chiropractor. You would need to do an 855B. In that case, you'd also need to do the 855I for any chiropractors or providers that are going to be reassigning to that clinic. That 855B is also only going to be used with typically it's incorporated tax IDs. That 855B, that B stands for business. So we're looking for that corporate level of information. When you're submitting the enrollment forms, there is some documentation that we're going to need for chiropractors. And we mentioned the license. That's if you're enrolling an individual. But typically documentation is a bigger concern when you're filling out that 855B. So the types of information that we would need would be tax identification number verification, and this typically comes in the form of a CP 575, a 147C, some type of notification letter that was printed from the IRS computer. It cannot be handwritten, and this helps us verify that we have the same legal business name on file as the federal IRS does, because it comes tax season. They do compare those legal business names, and if they don't match, sometimes the provider can be subject to backup withholding, where we take a percentage of each claim, and that can sometimes be a cumbersome process to straighten out and get those payments back to you. So we try to take a proactive approach of preventing that from happening. The other thing is a business license. This is something that may or may not be required for your entity to practice. If a business license is required by your city, county, or your state for your office to be open, CMS requires that Max obtain a copy of that. If a business license is not required, a statement indicating that a business license is not required will need to be submitted with the 855B application. And again, this is specific to 855B applications. That is not something that the MACs are able to work with the governing bodies that oversee those business license, because it's simply too vast. We're talking about every city, every county that would need to be contacted to determine it. And it could have to do with where the business is located. So this is one that we do ask for either a copy or a document showing that it's not needed. We'll talk about the 460 and the 588 in a little bit more detail in a minute, but if the chiropractor wishes to be a participating provider, which is the Medicare equivalent, they're not exactly the same because Medicare doesn't have networks, but it's the Medicare equivalent of being an in-network or a preferred provider on the private side of things. So the CMS 460 is optional. If a provider's filling that out, they are telling us that they want to be listed as a participating provider, and we'll notate that on their file. We'll talk about that form in a minute. The CMS 588, if the provider is obviously going to get paid, they're going to get paid electronically, and we need that form to set things up. And then as part of that, we're also going to need bank account information for verification. So I'll start with the 460. As I said, this is optional. If a provider fills this out, they're telling us they're going to accept assignment on all claims, which means they're taking Medicare payment as payment in full. And if a chiropractor is setting up as an individual in private practice or a group, they will need to fill this out. If a provider is reassigning benefits, so if your chiropractor is joining an established group, this is not needed. Again, this is for solo providers and groups that are being set up for a chiropractor. Those providers that are reassigning are going to follow suit with the group that they're joining. All of that metadata is already set up, so they would not need that. It's a simple form. Basically, we're asking for the provider's name and address. We're asking for the Medicare number, which can be left blank if they're assigning for that P10 for the first time, which is typically the case, and then a signature and a date from the provider, the authorized delegated official. The CMS 588, this is not optional. So Medicare only makes payments electronically. Medicare will not issue paper checks. So this form does need to be completed in order to obtain the account information. This is also used as a change of information when that account information changes. If the routing number changes, if the account changes, if the provider's name changed and they're getting issued a new P10, they need to fill this out. So it's going to ask for the name of the bank, going to ask for the account holder's information, it's going to ask for the routing number, the account information, some contact information, and then an authorized delegated official or that chiropractor, if they're a solo, is going to need to sign and date that. In addition to that, we are going to need documentation that verifies that account. That documentation can come in the form of either a voided check or a signed letter from the financial institution. It can be signed by anybody from that financial institution. It doesn't necessarily have to be president of the bank or a certain level of title. A teller can actually sign that information for you. And then with the voided check, the one thing I do want to point out, it cannot be a starter check. It does have to be a pre-printed check. There's not a regulation as far as the check number. It doesn't need to be over a certain number. However, it does need to be an actual check and not a starter check. So that brings me to our first question period before we get into claims. Mary, do we have any questions in the chat?
Leanne, we have one question from Mary. When enrolling a chiropractor in PAYCOS, does PAYCOS choose the correct forms applicable to a chiropractor? For example, the 855 and or 855B.
It will. So like I said in the beginning, you are going to answer some questions. So it'll ask for your provider's identification information. It'll already have some of that from the user ID and sign on, but it's going to ask for the specialty and you'll select chiropractor. Then it'll ask you to tell it about how you're enrolling. Are you enrolling as a solo provider? If you are you using an incorporated tax ID? If you are enrolling under just say a social security number, it's just going to give you the 855I because it knows that's how you can enroll. You're under just a social. If you're reassigning, it's going to basically give you the fields for the 855I. You won't see the 855 numbers. PAYCOS doesn't work that way. It has topics, but the topics are named in a similar manner to the physical paper application and asks for the same thing. Now, if you were to tell PAYCOS that your provider was practicing under a tax ID and it was incorporated, then it would ask questions about, is it a group? Do you have multiple owners or owners that aren't providers that are going to be practicing? It's not a solo situation. Or is it a solo situation and the provider happens to have that incorporated tax ID? What it's going to do, it's not going to make you fill out two applications. It's going to add in the sections that would make up that 855B. What happens on the MAC side when that gets submitted gets broken up into the two applications if it's needed, or it comes in as the I or it comes in as that B. So a lot of that is behind the scenes. PAYCOS takes care of a lot of that deciphering for you. Excellent question. Thank you. Mary, do we have any others?
There are no questions now.
All right, thank you. So next we'll move on to chiropractic claims basics. So chiropractic services are billed using the CMS 1500 or that 837P electronic transaction. When submitting claims, there is going to be some information that must be included in order to avoid any denials or delays. So this information, the things you want to consider here, we're going to need the initial treatment date. And this is the date that the provider either will have they first saw their patient, the date they made a diagnosis, or they initiated a treatment plan. You also need to make sure that you're including a diagnosis that is going to show the medical necessity. Now, there may be multiple diagnosis codes depending upon what the patient is presenting with, and you can list those on the claim. However, it's important that the first diagnosis listed on the claim is the diagnosis that will demonstrate the level of subluxation. You can include those symptoms, like I said, those conditions, they can be listed, but they have to be listed basically as a secondary diagnosis on the claim. They can't be in that first position. Entering this incorrectly absolutely could result in denials or make the claim appear to be maintenance or cause delays. So that's an important piece, making sure that that level of subluxation is that primary diagnosis code. Next, obviously, the provider is going to need to list the procedure code that describes the services that are being provided that day. We're going to talk about that a little bit more, but there are only 3 procedure codes that are billable by a chiropractor. And like I said, we're going to walk through those more in a minute. And finally, you're going to need to make sure that you have the date of service and the place of service called out on that claim in order for this to adjudicate appropriately. So let's break this down a little bit and talk about the procedure codes. So as I said, there's 3 procedure codes for chiropractors. They are all for the manual manipulative treatment of the spine. However, the difference, as you can see here, the difference is that the codes identify the number of regions that were involved in the manipulation. So 98940 is for 1 to 2 regions, 98941 is for 3 to 4 regions, and 98942 is for 5 regions. Keeps it simple. And those are obviously, as I said, the 3 codes that you're going to be able to bill. I do want to point out that none of those codes are including x-rays. And this is outlined in the CFR and the Medicare Benefit Policy Manual, Chapter 15, that I directed you to earlier. But x-rays are not covered when performed, ordered, or provided by that chiropractor. Chiropractors absolutely can order them. They can take them, they can interpret them as part of their encounter with the patient. However, Medicare is not providing coverage and payment for those services. They're not required as part of the service, but they can be used as documentation to support the medical necessity of the treatment. Along with procedure codes, chiropractors are going to have some modifiers that they can use on their claims. So first, the AT modifier. So the definition for this modifier is chiropractic manual manipulation of the spine for acute therapy. Now it can be applied to all 3 of those, and this is what's helping us identify that code as active treatment. You would use it when there is our services being performed for active corrective treatment of the spine. And this would include anything that is manual manipulation, just hands only, or using the assistance of a handheld device that needs to be manually controlled. And the other part of this is that the result of that manipulation is expected to improve the patient's condition. Without this modifier, that procedure code, when it's billed on that claim, is going to look like a maintenance service and will likely be denied. So keep that in mind. There may also be instances, just depends on the encounter scenario, where a provider may need to use a modifier 25 if there are multiple services that are separately and identifiable. They're not related. For instance, perhaps a patient had to receive multiple appointments, had to receive multiple manipulations. It is likely that an AR25 may be needed to identify those as separate so that they're not looking as if they're a duplicate. And then the other modifiers that may be used are related to the advanced beneficiary notice of non-coverage. There could be instances where a claim is being billed, but we know ahead of time that it's either not medically necessary, it's not covered. You could use the GA, the GX, or the GZ modifier, depending upon the scenario for that encounter. Next, I want to talk about documentation. So chiropractors, as I've mentioned a couple of times, they do need to document medical necessity, and they're required to maintain documentation for all of their encounters with their patient. There are going to be times where they may be asked to provide that to support a claim that is in process or perhaps an appeal. So again, it has to demonstrate medical necessity, and it is required for each spinal manipulation. So the things that should be included would be the level and location of the pain, what misalignment or subluxation is observed, Are there any range of motion abnormalities? The documentation, as I said, it can include the x-ray, but as I mentioned earlier, that part is not necessarily, that's not going to be reimbursed. So it's being used more from a documentation perspective. And the other thing that you want to keep in mind is you do need to document their initial visit, and we'll talk about these in a little bit more detail, but their initial visit, any subsequent visits, and any treatment plan that's been established for that patient. The other thing that we'll see, it's super important and it can be missed, is that the documentation must be signed and dated by the chiropractor. It's not considered valid documentation if it's not signed. That's kind of that, it's like the application form. That is that attestation that what is here is true and correct. It's certifying that that documentation and the is valid. So for the initial evaluation, documentation should include the patient history. So that would include the date of the encounter. It will include the initial date of the treatment. What were the symptoms? What was the cause of their trauma? Were they in an accident? Did they fall? Whatever the case may be. Are there any contraindications that we need to be aware of that might steer the treatment plan? Are there any observations from that physical examination? Are they having issues with maybe walking? Are they maybe favoring a part of their body? We also need to know the level of manipulation. So again, for that claim, the number of regions is going to dictate which procedure code is used. And then we also need to know how that manipulation was administered. For subsequent visits, so this is generally also outlined in the treatment plan, which we'll talk about, but you'll need to document all subsequent visits. So that could include reviewing the history of the chief complaint. Have there been any changes since the last time that you saw that patient? Another physical exam to assess the patient's condition. Are there any changes to that patient's condition since you last saw them? Are they improving? Are they deteriorating? Are there any setbacks? Do you need to make any changes to that course of treatment? And then obviously you're going to need to document what treatment was provided, level of manipulations on that subsequent visit. And finally, you're going to need to document the treatment plan. So what is the course of action that you have planned for this patient? How often are you going to see them? What's the frequency of those visits? How long will those visits be? What are the duration? Certainly that depends on the number of regions, the severity of what you're treating them for. What are those treatment goals? How are we going to obtain them? You want to make sure those treatment goals are specific and that you're documenting those. What are your objectives? What are you going to be using to determine whether or not that treatment was effective and is improving that patient's condition? And then what's the recommended level of care? Obviously, that is that future state, what are we planning on doing? And certainly this can be adjusted, but it's definitely something that you need to make sure that you're documenting. And again, it needs to be provided upon request. Now, we do have an article available on our WPS GHA website, and Mary's putting a link in the chat for that outlines that information. Do you want to take a step back as well? I did have Mary earlier provide a link to our Medicare coverage database, and this would be specific to those procedure codes. That link, and actually I'll take you out to that. That particular link will take you to an article that provides a lot of information regarding those three codes, but it also includes information regarding the diagnosis codes that can be used. So this will also be a helpful resource to you, and it includes information on non-covered services. So I highly recommend you leverage this when you're submitting those claims. Along with that, I am providing you with some CMS resources today. This is another link to that Chapter 15, Section 30.5 that outlines chiropractic services. I'm also including a Medicare Learning Network article that is a documentation checklist for chiropractors that'll help as you're documenting the treatment plans and their visits. And then I have included a couple of other coverage articles that are available to you that also provide a lot of the information and support of the information that we've presented to you today. We also have some WPS resources available to you. So I've included links to a couple of articles, chiropractic services. This is a good general overview of chiropractic services. Then there's chiropractic claims, which walks you through those claims requirements and documentation. The last link is one I'm really hoping to encourage all of you to check out. That is a section in our training center, and it is a specialty training section of our website, and it is specific to chiropractic care training. This is a good one-stop shop. It has really all of the links that we're talking through today and a couple of additional ones. Also, we'll see links there for our YouTube channel for any encore presentations or any YouTube videos that may be helpful to you. So with that, I'm going to check in with Mary. Mary, do we have any questions in the chat?
We do not.
All right. Thank you, Mary. All right. One more time, just check in with Mary. Have we received any more questions in the chat?
We have no unanswered questions in the chat. Thanks.
All right. Thank you, Mary. So with that, that does bring us to the end of the presentation today. On behalf of myself, Mary, and everyone in the GHA Provider Outreach and Education team, I'd like to thank you for taking the time to attend today. We look forward to those survey comments, and again, please include topics that you'd like to see in the future. I want to thank you all for taking the time today, and I hope you are well. Have a great day. You may now disconnect.